What is it like to have cancer? It's scary as hell to have cancer.
According to the World Health Organization, there are approximately 1.38 million new cases out of 458,000 deaths from breast cancer each year. Breast cancer is by far the most common cancer in women worldwide, both in developed and developing countries. In Indonesia, the number of new cases is the highest. Moreover, the data from the Ministry of Health of Republic of Indonesia shows that January 31st, 2019, the average death from this cancer is 17 people per 100,000 population.
Cancer, in whatever form, is a chronic illness. Even if you have been declared cured by a doctor, usually defined as surviving beyond 5 years after diagnosis, there is almost always a need for lifelong vigilance and surveillance to be sure the cancer hasn't come back. So often, current medical therapies are brutal, making people very ill, often with poor results nonetheless. They can produce distressing and demoralizing side effects like pain, nausea, vomiting, hair loss, bad fatigue, and others. And we present you with the great solutions for breast cancer therapies called PEMF, Pulse Electromagnetic Fields. PEMF therapy involves applying electromagnetic waves from the harmless part of the electromagnetic spectrum to the body. These waves are typically delivered via a special yoga mat on which the patient lies. There is a reason to believe that resulting extremely low-frequency magnetic stimulus interacts with the cells to increase oxygen circulation, reduce inflammations, improve mobility, ease pain, and promote faster healing. It may increase cell energy and cell metabolism, decrease inflammatory cytokines, and perhaps restore the balance between free radicals and antioxidants. We built this technology using comfort and modern designs, especially to indulge the users. There are many advantages that you can enjoy from this technology. PEMF is safe to use. Research and clinical experience show that low-intensity PEMF doesn't produce side effects. PEMF combines readily with other types of cancer therapy. There is no risk of adverse interactions with therapies or other treatments that patients receive. Portable technology. We designed the mat have a lightweight so you can bring it anywhere and everywhere you go. This aims to facilitate you to do the treatment whenever you need it. PEMF brings no risk of toxicity. There is evidence to suggest that PEMF can actually oxygenate the blood, increase the production and function of healthy red blood cells, and facilitate the repair of damaged red blood cells. A very comfortable solution. PEMF is non-invasive. No needles, infusions, or other forms of invasive therapy needed in this treatment. This device doesn't cause tissue damage in the patient body. This graph shows the mechanism of actions of PEMF in the killing of cancer cells. MCF7 breast cancer cells and their normal counterparts, MCF10 cells, were exposed to PEMF and cytotoxic indices measured in order to design PEMF paradigms that best kill breast cancer cells. The PEMF parameters tested were first, frequencies ranging from 20 to 50 Hz, second, intensities ranging from 2 mT to 5 mT, and 3, exposure durations ranging from 30 to 90 minutes per day for up to 3 days to determine the optimum parameters for selective cancer cell killing. In the context of the current study, 3 mT PEMFs at the frequency of 20 Hz for 60 minutes per day would create the correct combinations of signals that would most effectively result in cell death. The damage done by PEMFs will only affect cells that are malignant, such as cancer cells. However, this will not affect normal cells but instead is enriched. This concept is the latest breakthrough from existing breast cancer therapy. Using super sophisticated technology, we make this equipment very flexible so it can adjust your needs.